Begin today's webinar, we would like to take a moment to reflect and acknowledge. I'm honored to welcome Dr. Kimmery Bug, the CHAMPS Community Engagement Officer and CEO of ROSE, Reaching Our Sisters Everywhere, who will be speaking to some of the events of the past weeks. Now I'll hand it over to Dr. Bug. Thank you.
I'm thankful for the opportunity to speak to you all for just a moment, and would also just like to say that I truly do miss you all. I wish we were there. So I just want to say that because of COVID-19, there was already a tremendous fear and trauma in the African American community. There are large numbers of African American people who are essential workers and have died or lost their jobs or are, disproportionately affected by COVID-19, which was already extremely painful for everyone. And again, as all of the statistics still continue to show that a large majority of the people who have been sick and have died have been African American. So that was extremely difficult because African American community a lot of times work as essential workers, and they had to choose between their economic security or their health security, which definitely put them in harm's way. So recently, on top of this trauma that the country was experiencing, and again, the African American community even more, was the incidents of the last couple of weeks. 5 incidents happened the weekend of Memorial Day when the communities were already grieving the murder of Ahmaud Arbery. And then the week before, Breonna Taylor was killed, and then George Floyd. So the community sort of just come to a boiling point, which was extremely difficult and is not being handled very well in several communities. Riots are the language of the unheard, is something that Martin Luther King Jr. said over 50 years ago. No one sanctions riots, but protest is a right of the American citizen. And so we will continue to have these protests, it looks like, until some voices are heard. A favorite poet of mine, Audre Lorde, said that it's not our differences that divide us, it's our inability to recognize, accept, and celebrate those differences. So it is important that we have these crucial conversations to alleviate these problems, these disparities, these inequities that are in the community that are so blatant and have been blatant in the African American communities, of course, for centuries. This is just a little image I wanted to share. It's just to depict that, the journey, we may be going to the same place, but the journeys have been different for different segments of the population. We've had to endure a lot more things than some. So please just consider that and continue to give the compassionate care that you all are giving, and just know that you are truly appreciated. One of the things that I've heard as I go down to the protests, and I go in the daytime and come home early as an old person, but I feel that it is important for me to be there. But one of my favorite statements that have come out of it is that silence is violence. If you don't say anything about the atrocities that are going on, then that truly is violence. So thank you all for allowing me just a few minutes to talk, because this has been extremely painful and extremely traumatic for my family, for my church community, for the people I work with. But the wonderful thing is that there are so many allies of every ethnicity that have come to the aid and are continuing to protest. And we completely, totally appreciate that. Thank you very much.
Thanks, Kim. Thank you for speaking for us. I know it's not easy for anyone to speak to this, so thank you very much for taking that time there. Okay, thank you all for coming to the webinar. Thank you, Kim, for speaking. Thank you to my team here who are all about to speak up today or are working behind the scenes. And thank you to all of the Mississippi hospitals and communities who are on the call today. And I do see we have some old friends from Navajo, Jeanette, and other of our American Indian colleagues. So thank you for coming. We've been doing a lot of webinars recently about COVID, and we have also been talking to our different communities. We've had lots of speakers. This one is more aimed really at our own community, I would guess, the CHAMPS community and those we've worked with. Of course, it's open to the public, but today we're particularly working to update everyone on the Mississippi CHAMPS project, share some of our data, some of your data with everybody, and talk a little bit about what's going on right now and what's going to be happening in the future. So it's amazing to think that CHAMPS in Mississippi has been going on since 2014. I realize that some of those on the phone won't remember that, you know, weren't around in the profession when we began working in CHAMPS in Mississippi. So just sort of recall that. We first started enrolling hospitals in the South into the CHAMPS program in 2014. And then wave 2 of funding and enrollment started in 2017 and is finishing this year. And we have had, if you cast your mind back, we've come a very long way. So since 2014, when there were no baby-friendly hospitals in Mississippi, 20 Mississippi hospitals have been designated baby-friendly, and 18 of them are in the CHAMPS program. So let's take a moment to really think how wonderful that is, and of all the marvelous interactions that we've had and all the work that we've all done together, and that the community and the hospitals have really done during this period. It's an amazing achievement really from all of you, that half the hospitals in the state are now baby friendly, and of course would have been even more progressing if we hadn't been for COVID, because it kind of brought us to a halt. More on that later. This is where we were at the beginning of CHAMPS versus where we're at now. So you can see that at the beginning of the project, for example, at the time that hospitals enrolled into the program, for example, 12 hospitals didn't have any interest in becoming baby friendly. And now everybody's on the pathway that's in CHAMPS, and many of you have been designated, and others are very close. So you can see that, for example, in June 2020 here, you know, in addition to the hospitals that are designated, there are 11 hospitals in the designation phase. So everybody's moved towards that, and we're really pleased, and thank you all for all the work you've done, and that's great. So I'm going to share some data with you now. Before we do that, here is the list of Mississippi CHAMPS designated hospitals. So everyone cheer for yourselves, because you've done a great deal of work. So thank you all for all the work that you've been doing, and congratulations again to everybody. And so you, as part of the whole CHAMPS project, have been sending your data to us, which we also appreciate very much. And I hope that it's been helpful to you to examine the data. And as we do at the beginning of each CHAMPS conference today, I'm going to just present to begin with the data, which is pretty cool. So, and I always have this little caveat, the stuff at the beginning doesn't really count, the very, very beginning, because we had only 2 or 3 hospitals worth of data then. So, you know, one hospital reporting or not even sending the data in could make a huge difference. But you can see from the black dotted line, which is the trend line, and each of these graphs are presented in the same way, that, for example, rates of skin to skin after vaginal delivery it's about the 39. We don't always have everybody's data every month, but generally it's around between 30 and 39 hospitals reporting in. The rates of skin-to-skin post-vaginal have gone up. And again, at the end, don't take too much notice of those funny little things, although we have noticed a decrease in skin-to-skin during COVID, which I'll also mention later. But again, like the beginning hospitals, the hospitals at the end, also, it's not as many reporting. So the trend line is from about 35% to about 90%. Okay, so also we're looking at the rates of skin-to-skin post-cesarean delivery, and you can see that those have gone up from virtually 0 to 74%. We also track all these data by race. So you can see that the orange line or the red line is the Black population, and the yellow line is the white population. The blue line is the average. And we do track other races, but to put lots of lines on this graph, it makes it too complicated. So we just use those three. So you can see that the rates of skin to skin have gone up from almost nothing to almost 80%, which is compliance with baby friendly. You have to meet 80% of the requirements. So that's great. And then you can see that rooming in also has gone pretty much from 0 across the state. In 2015, we enrolled the first hospitals in 2014, but we didn't really start to get your data until 2015. So it's gone up tremendously, and that also is over 80% now. And you can see that actually that's peaked up a little bit during the COVID epidemic, which reflects some hospitals actually requiring rooming in because they want to keep the babies' moms together to protect them from being exposed to others in the hospital. And then, our sort of secondary measure, I mean, of course, this is what we're aiming at. We're aiming to increase breastfeeding, but you can see these rates don't go up quite so dramatically because the practices change, and that leads eventually to changes in our breastfeeding rates. And you can see here that the initiation rate has gone up. And again, the ones at the very beginning and the very end shouldn't be too concerning. You can see if you look at the dotted lines that we have narrowed the gap between the Black population and the white population. You can see there's a sort of, they're going towards, that yellow line from the top is going towards the red line. So here there's a smaller gap at the end than there is at the beginning. And this is our exclusive breastfeeding rate that's just about to come up. So you can see here too that we have brought those up as well. And I'm going to just talk towards the end of some publications, but we are working on analyzing the data so that we'll be able to tell the statistical significance on which of these rates of breastfeeding are associated with particular practices like rooming in, etc., in which communities. So we're now going to do a quick poll. Please go ahead and vote. The question is, think back to when your hospital first enrolled into CHAMPS, and then think about the hospital in your community as it is now. Is the hospital further ahead than you thought, about where you thought it would be at this point, or not making as much progress as you think it should be? If you are not part of a hospital, but you're in a community that has a hospital that you identify with, please also vote. Okay, Metal, let's look at the results. Okay, so most people who responded said that the hospital is further ahead than they ever imagined it would be. Okay, great, thanks. Let's go on to the next slide. Okay, so we were sort of zooming along happily, and then along came COVID-19 and put a stop to many things in many of our lives, not just to the CHAMPS program. Everything's had to change and be readapted. So, we were kind of in the full throttle of hospitals becoming designated. Many hospitals had assessments set up with Baby Friendly USA, and we had a whole 10 days of our team coming down there planning to do mock assessments, and we did have to call a halt to it. So a lot of site visits and Baby Friendly USA assessments are cancelled. So actually I'm going to turn them over to Becky at this point, and she's going to talk to you about the latest from Baby Friendly USA in terms of what Baby Friendly USA, the board that designates hospitals, is doing in terms of changes and adaptations for the COVID-19 epidemic. So Maytal is going to hand the slides over to Becky at this point.
Great.
Okay.
Thank you. Thanks, Anne. So updates from Baby Friendly on COVID-19. As Anne's been saying, the first bullet there, COVID is a moving target, and we met with Baby Friendly to kind of go over some of the changes that they have been working with hospitals on. The underlying tone is that really it's a moving target and it's hard to do this, but Baby Friendly USA is working hard to provide guidance for hospitals where they can. Baby Friendly has worked group by group to kind of work through the guidance that they'll give hospitals. Baby Friendly grouped hospitals into hospitals on the pathway, hospitals awaiting assessment or requesting their on-site assessment, and then hospitals in annual quality improvement and redesignation. So we'll start with, sorry, I advanced, there we go. So for hospitals on the 4-day pathway, Baby Friendly has planned to grant extensions on an as-needed basis for hospitals individually. So if hospitals are having any sort of trouble meeting the current deadlines, they should contact Baby Friendly, and they'll work with you case by case. Hospitals should also keep checking the Baby Friendly USA portal for updated information. They will be giving you updates through the portal. So keep checking, especially if your years are coming up or you have concerns, or if you want to move forward. It's great to check the portal to see what they've said for hospitals on the pathway. For hospitals that are awaiting on-site assessment, as you may know, if you've had an assessment scheduled, assessments are currently postponed through June of this year. The upcoming months, Baby Friendly is still trying to figure out, depending on how things go with coronavirus. They do recommend that all hospitals still request on-site assessment dates to get in line for when hospital assessments resume. So they want to make sure that hospitals that are ready to have an on-site are putting their request in, because they are doing things in order. Baby Friendly has said that they are going to hold practice update calls with hospitals who've been delayed, and we've heard some feedback from hospitals already that they have had some calls scheduled. So if you're in this group of hospitals that's waiting or has been delayed, be on the lookout for communication from Baby Friendly on this practice update calls. And then lastly, Baby Friendly has put into planning a way to conduct future on-site assessments in 2 parts. So they're looking at providing a virtual portion and an on-site portion. And that will be something that we'll learn more about in the near future. I think, perfect. And the last group of hospitals, to kind of give an overview today, are the designated hospitals. So for hospitals in their first 3 years of post-designation, they're in the annual quality improvement section of hospitals. Baby Friendly has published extensions on the portal for the requirements and AQI. They've also removed the audit tool for step 6 from the list of required audits. This is out of the audits that were required for 2020 for hospitals and AQI, step 6 involved patient interviews, and they're trying to help hospitals decrease the amount of going into patient rooms for the audits. So that's why they've removed that one. For years 4 and 5 in AQI, these are hospitals that are in redesignation that are working towards their redesignation on-site assessment. Baby Friendly has also published extensions for these hospitals that you can find on the portal, but all of the audits will be required for these hospitals. And again, like any hospital on any point, any part of the journey for Baby Friendly designation, hospitals should contact Baby Friendly if they have trouble with any of their requirements. And I think, yes. So we are, in terms of our response to coronavirus, we are closely monitoring breastfeeding rates and maternity care practices in Mississippi CHAMPS hospitals, as Ann just started going through the data. We are starting to see that breastfeeding exclusivity may be increasing, skin to skin is decreasing, rooming in is increasing, and perhaps maybe disparities are increasing. We're still monitoring the data. CHAMPS surveyed all Mississippis for changes in practice. And if you haven't seen this survey, and you're a hospital that is participating in Mississippi CHAMPS, or you haven't sent it in yet, please do so, or let us know if you aren't sure what we're talking about, because we're happy to talk to you and resend it. Great. So survey responses for CHAMPS hospitals. We designed a survey for hospital task force leads to learn about changes in their hospital practice in response to COVID-19. Today, we have results up through June 2nd, which is yesterday. And so far, 29 hospitals have responded to this survey. Out of the 29 hospitals that have responded so far, a little less than half have had maternity care patients with suspected coronavirus or confirmed coronavirus. Almost all facilities are practicing universal screening. 45% are also practicing universal testing. 17% are testing patients whose screening reveals risk factors for COVID. 14% are not testing patients at this time. And all tests are done by nasopharynx samples. In terms of facility visitor policies, all facilities have some sort of limitation on the number of visitors for maternity care patients. 90% only allow only one visitor. It could be either a support person or a partner or father. In terms of skin to skin, we asked facilities how they managed skin to skin or plan to manage skin to skin. For healthy moms and babies, hospitals are mostly adhering to their normal practices. For mothers who are COVID positive or persons under investigation, hospitals are divided between those who encourage skin to skin with new practices to prevent infection, using a shared decision-making approach, and not encouraging or allowing skin to skin. So you can see a kind of a range there. For rooming in, facilities, we asked facilities how they plan to manage or are managing rooming in. For healthy moms and babies, all hospitals are maintaining or strengthening their rooming in practices. For PUI mothers, 28% are encouraging rooming in with new practices to prevent infection. 31% are using a shared decision-making approach, and 10% do not allow it. For mothers who are COVID positive, 14% encourage rooming in with new practices to prevent infection. 24% are using a shared decision-making approach. 10% are counseling mothers against it. And 31% do not allow rooming in for mothers that are COVID positive. As you can see at the bottom of the slides too, a small amount of hospitals have responded, I don't know, to that. For feeding recommendations for COVID positive and PUI mothers, only one facility, as you can see here, only one facility is advising that mothers feed formula in this situation. The rest recommend direct breastfeeding, usually with extra hygiene practices to prevent the spread of infection, or feeding the infant express breast milk. And then lastly, we asked hospitals what guidance they were using to create practice guidelines for COVID positive or suspected patients. 83% are using the CDC, 62% using AAP, 45% using the World Health Organization, and 10% using the Academy of Breastfeeding Medicine. 24% say they don't know. Great, and we are at another poll.
Okay, I'll read out the poll questions. This one is, given where Mississippi is at with COVID-19 infections right now, do you think it's going to get a lot worse before it gets better? infections will continue at their current rate, slow and steady over time, which is what we're seeing basically, or Mississippi will probably see a decrease in COVID-19 rates from here on out. So please, we'll give you a couple of minutes. So given where Mississippi is at with COVID infections right now, it's going to get a lot worse before it gets better. We think it'll continue just like it is, or we'll probably see a decrease in COVID-19. Okay, let's have a look at the results. So looks like most people are not very optimistic and think it's going to get worse before it gets better. People think it will continue, and a couple of people think it will actually start decreasing from now. So I guess you're kind of where the rest of the world is right now, is a reflection of the Mississippi that people don't really know. None of us really know, but given that you think it's going to get worse before it gets better, let's all keep doing the things with precautions, because for sure it hasn't looked fantastic lately in Mississippi. It has been going up. So although you're not at the levels that it's been in some of the other states, definitely the precautions that you guys are taking should continue. Okay, next slide, Metal. Who's next here?
I believe it is me.
Okay, great, thanks.
So in addition to conducting surveys with CHAMPS hospitals and closely monitoring breastfeeding rates and maternity care practices, another way that CHAMPS has responded to the COVID-19 pandemic is through launching a series of webinars, which I think you all may be aware of, given that you're on this webinar now. So thank you for joining us. And this is our series flyer for our first round of webinars, which ran from April 22nd through today, June 3rd. And then we'll be launching our summer series on June 17th. And that will run at least through the beginning of July. And recordings for all of our past webinars are available on our website at the URL on the screen. And also on our website are available downloadable versions of each of the slide decks for the webinars. So just a few highlights. Each week's webinar has addressed a different topic presented by a series and set of esteemed speakers. So we've heard from national and international experts, including Dr. Ricardo D'Afonso, as he discussed his key role in and process of creating Italy's national guidelines on COVID-19 and breastfeeding. And we heard from Diane Spatz, Dr. Diane Spatz, the next week, as she explained the steps that we can all take to protect human milk and breastfeeding, and the role of shared decision-making, which was also touched upon in future webinars, among many others. And I just want to say an extra thank you if any of our past presenters are on this call as well. Thank you for sharing and joining us. So we're also very much looking forward to our summer series, where we're hosting some new and very exciting speakers as well on some interesting and important topics. So again, the first one will be on June 17th, and it will be presented by Dr. Anita Henderson, who's president-elect for the Mississippi chapter of the American Academy of Pediatrics and baby-friendly physician champion at Forest General Hospital, along with Dr. Michelle Owens, who is a professor in the Department of Obstetrics and Gynecology at the University of Mississippi Medical Center. So be on the lookout for more information on our upcoming summer series of the CHAMPS COVID-19 response webinars on your email and social media and on our website. And we look forward to having you join us in a couple weeks on our first summer series webinar. And now I'm going to pass it off to Aisha, who will be discussing some other online CHAMPS work prompted by COVID-19. Thank you.
All right, thank you, Maytal. In addition to our webinars, which Maytal just described, we are working on launching 2 new resources. One of them is the CHAIR newsletter, which would basically provide snapshots of a snapshot update of our work, the data, resources that we think you might find valuable, and maternal child health literature. We will email these newsletters out to from time to time. So if you currently don't receive emails from us, like CHAMPS emails, and you would like to receive the newsletters, please put your name and your preferred email address in the chat box, and we would kind of add you to the mailing list or emailing list. The second resource is our CHAMPS Q&A forum. So this is basically going to be a centralized medium where we can interact with everyone and kind of respond to pressing questions that people might have. So it's supposed to be an interactive forum where you can add your questions and answer other people's questions and just kind of level as much as possible. So once this is live, we'll announce it on all our social media platforms and add the link to our website as well. And yeah, so now we're just going to go through really quickly in a few minutes how to use this platform. To access our new CHAMPS or upcoming CHAMPS question and answer forum, you just go to any browser of your choice, whichever one you use on your laptop or your phone or any other device, and you type in chairequity.answerbase.com. And once you click on enter, you should automatically see this page come up. So this is the home page, and I'm going to run through really quickly or in a few minutes how to ask questions and how to answer them on this Q&A forum. So to ask a question, you go to this ask a question here box and you type in whatever question you'd like to have answered. So for instance, I'm going to type in, where can I go for the latest COVID information? So automatically it's going to give you, if there are similar questions that have been posted already, that would come up. But I'm just going to click on continue posting as a new question. And then this page should come up. So this is the page, once you've typed in that heading or your major question, this page would come up. And you can go here in this box right here to type in the details of your question. So the background, the context, what you would like people to consider when trying to understand or answer the question, everything would go in the question details box. And then you'd come here, down here, and select what category you would like to tag your question in. So for instance, this is a COVID-19 related question, so I would tag it under COVID-19. And then you would click on continue to question preview, which would just be the page where you can review your question before submitting it. And so I'm going to click submit. Okay, so once you do that, it would bring you to a page where you kind of have to log in. You can log in with Facebook, or you can create a new account if that's what you would prefer. Because just so everyone has a user profile when answering questions, so we know who's answered what, when, and where, or who's asking the question. So now I would connect with Facebook automatically. All right. So it says my question has been submitted, and I could just go to the home page to see my question, which is right here. Where can I go the latest COVID information? All right. So now to answer a question, say if I wanted to answer this question, should a mother who is COVID-19 positive breastfeed? I would click on the question like so. And when this page comes up, I would click on answer this question. And then I would type in my answer here. So I would say, absolutely, right. Okay. And then I would include my source. If you have any sources or any form of references that you would like to include, you just put the link right here. And then you would click on submit answer. So this is just going to ask you if you would like to subscribe to the tag COVID-19, which means every time someone posts a question or an answer that's tagged COVID, or an answer to a question tagged COVID-19, you would get a notification about it. So then you could go, you would see this page, which just confirms that your answer has been submitted. And if you click on view here, it would take you to the page of that question that we just answered. So and this is my response right here, absolutely. So you have up to 15 minutes to edit the answer if you want, before it's automatically posted and you can't really edit it anymore. So yeah, so that's just like the brief overview for how to ask and answer questions on our CHAMPS Q&A platform. Thank you. So yes, thank you, Maytal. That's it. If you want it live, we're going to have it on all of our social media. And if you could please just go on there whenever you have to answer questions and include references. We just need, it's an interactive forum, so please interact on there. So thank you.
Great. So next we're going to talk about, so what are we doing? How are we sustaining CHAMPS and the work that hospitals have done over the past 6 years and beyond? So over the past 6 years, CHAMPS has been working closely with hospitals to sustain and advance the progress that hospitals have done. We're talking about progress on the baby-friendly pathway, and then progress that hospitals have made status post designation. How are we supporting and working with hospitals? Well, we have held over the past few years nursing focus groups. We've held train the trainer events for the 4-hour clinical competency training, which is the hands-on training that many of you are familiar with, probably all of you. We've done trainings and train the trainer events for the safe implementation of evidence-based maternity practice training, a intensive hypoglycemia and hyperbilirubinemia policy review, along with work groups to assess supplementation in hospitals and to help hospitals really work on breastfeeding exclusivity. Hospital support through the AQI, meaning the requirements that Baby Friendly has hospitals do after designation to maintain designation. And then in 2019, we held a conference. Moving forward, there we go. Today, we're in year 2 of the CHAMPS sustainability program. We have reallocated much of the grant to work on our response to COVID-19 in Mississippi. And much of the work that you heard Maytal and Aisha discuss has been through this grant, but we continue to support designated hospitals through the sustainability program. So moving forward, we are still holding quarterly designated hospital meetings in group setting. We are still supporting hospitals through the annual quality improvement work through technical support and guidance. We are compiling, distributing, and reviewing CHAMPS quarterly data reports. We are holding one-on-one troubleshooting meetings as needed per hospital request. We'll continue to host trainings and assist hospitals with trainings per hospital or community request. And as hospitals continue working hard through this time period, there are still more hospitals that will be joining the group of designated hospitals very soon. Poll 3 will hold.
All right, so here's our poll for everybody. There's a few answers here, so read all the answers before you hit the button, okay? So for this poll, we say put yourself in the position of either at the hospital or in the community that is working around with the hospital. So we've all done a great deal of work to get our hospitals to where they are right now. Going forward, which of the following do you, the voter, think will be most critical for continuing and maintaining the progress? And the answers, and remember there's a last answer to read, don't hit yet. Staff training, continuing to collect data, community involvement, increasing prenatal awareness, or all are equally important. I can't choose one. So please go ahead and vote for what you think is going to be the most critical thing going forward to make this work and continue to hold the work so that the work continues and that we don't slip back. Okay, so we will stop the poll. And they all are equally important, folks won. So it looks like in general, people think that all components of this program are equally important, which is great to know, because I guess that's the kind of attitude we've been employing throughout. So most people said that all of those things were important. Some people felt that it would be really important to increase prenatal awareness of breastfeeding, and community involvement is also really important. So thank you for your responses. Next slide. Oh, it keeps showing on my screen. Okay, so is this the next slide? Or yeah, we didn't skip anything, right? Okay. So to speak to everything that has gone before in this webinar. We've got time to do this, that's great. We're really sad, really, that our original funding for the CHAMPS program will end on the 1st of August. We had 3 years funding from the Kellogg Foundation to begin with, and I do really want to thank our funders for all of their investment and help and input in this, because obviously funding has held it all together. This would not have happened if we hadn't had the funding, all the training, all the data collection, all our work, everything is all dependent on the funders. So Kellogg supported it for the first 3 years, and then Kellogg and the Bauer Foundation combined supported CHAMPS for the second 3 years, which is about to end. There is some funding which is continuing. So the sustainability work that Becky just spoke about, and also we have another program that's going on with UMMC and the Bauer Foundation to create an interprofessional education module that is that will wrap up also later this year, and we'll have produced that, which will be nice. But the main work that's continuing is the sustainability funding, and also we are writing several papers on the nursing focus groups that Becky mentioned, breastfeeding and practices during COVID, assessment of the hospital rate, which is kind of a repeat of the previous program, the previous paper that we did in the South generally. We're doing that for Mississippi, and then assessment of the CHAMPS program. So just to speak to these, the papers or the studies, we did get, as Becky kind of referred to, some of our funding was repurposed. So we got an extra, a small amount of funding from the Kellogg Foundation, and the Bauer Foundation basically allowed us to spend this year's funding on work with COVID-19. I just want to sort of emphasize that we don't feel at all this is a shift in direction. We just feel that it's addressing the current need. We've all had to shift. So we felt it would be good to make sure that we support you and the communities with information throughout COVID, which will help you to keep all of your breastfeeding and baby friendly progress going. So it's not like we said, oh, we'll stop baby friendly and we'll do this instead. We just feel that, like, with the whole emphasis on COVID and everything changing in healthcare at the moment, we needed to really address that in order to make things keep running smoothly. We also have funding which is for the next year and a half to assess the CHAMPS program itself. That funding is from the Robert Wood Johnson Foundation, and we're doing implementation science assessment of the CHAMPS program, which I know some of our partners have helped us with. So we are in a sort of wrap-up mode. That said, I can't remember if I had a slide for this. Let's see. We also have a big proposal in right now. We'll keep this going. So if we get the next grant, we will be back in spades. No, I don't have anything else on that, so let's just go back. We will be back in spades. So we have a couple of proposals out there that will address some of those things that you've been telling us about, which is prenatal education particularly, and also somewhat fittingly distance learning. And I'll be quite honest that we had hoped that by now we would know for sure, and we don't have the information yet for sure, if we're going to be able to continue in a very big way in Mississippi, or if it's going to be more of a sustainability approach, which we'll hand off to you eventually, which of course is part of this process. You don't want to be having to rely all the time on outside sources for your help. And many of you, of course, have taken this on. And in terms of the baby friendly, I think one thing we thought, you might need more help with than you did was the help meeting the QI requirements for Baby Friendly USA. And nobody's had any problem with that at all. And the data collection, you're all in the mode with that. So you just send it to us and we're helping to do the analyses, but we're no longer having to sort of teach you how to do it. So we feel like, really we have passed a lot of the torch, or shared the torch perhaps. We have come and we've helped you, and you're really running with the program, and it's been a wonderful relationship with all the hospitals. So I just want to thank everybody, and also the communities that we've had tremendous work that we've done with the WIC community, Rose of course, and all their community transformers and their community forums, and the work that Kim and her team has been doing. So we've been really, I have to say, sort of almost going back to Kim's original address at the beginning. I'm proud of a lot of the work we've done, and I'm proud of everybody that's worked on this program, and I'm very proud that we have the trust of the community from Mississippi. I feel like of all the projects I've worked on, the two most recent ones were Indian Country and now this one. I think for me, the biggest personal thing I take away from it is my real delight in the fact that we seem to be trusted in the communities, and we work together side by side. And we really, you know, that has always been the kind of way that CHAMPS has addressed things. And I'm delighted that we all have managed to pull that off together, because it's not, as we can see, it's not an easy task for any of us. So thank you. I would just like to end with a thank you, really. And we do hope, and it's not a sort of swan song, we do hope that we will get the next round of funding. We just don't know yet. So we aren't able to predict exactly what we were doing, but if we do get that, don't worry, you will be the first to hear. And we will be talking about our next sort of Let's Go CHAMPS will be about the new programs that we're going to be working on. And of course, don't go away, because yes, we have another 18 months of funding for the sustainability program and some of the assessments that we've been doing. So please keep sending the data. Going back to the mention of the COVID data and the survey, we are hoping to put that together into a paper. We are thrilled that it looks like exclusive breastfeeding is actually going up in Mississippi in COVID, and rooming in's improving. And, you know, as I'm sort of thinking about how we're going to write this paper, I think I'll end on this note. You know, it strikes me that I'm going to have to put a caveat into the paper that the data in this paper are not necessarily typical of the rest of the United States, because Mississippi is so far ahead with its baby-friendly practices that when we consider our hospital's data, we have to be considered that we're working with a group of newly or recently designated baby-friendly hospitals who have everything in place already. And so we won't necessarily be typical of all the practices across the US, because Mississippi is so far ahead. And I think we'll end on that note, and we will open it up for questions. You want to go into the next slide? This is just some of the information that we have on our website that you can get. We have a section there for COVID. As you can see, we're coming out with some new resources, like interactive resources. But this is all of these things, if you want looking for guidance in the current situation, are on our website. So yeah, just go to the final slide, and if anybody has questions that they want to say or comments in the chat. You've all been very quiet. Usually the chat's like buzzing. I'm sure it's because everyone's so focused. But please go ahead and ask your questions if you have any. And again, thank you to everybody, or comments, anything people want to just speak up about. I see so many of our friends on here. Please go ahead, and if anyone has any questions, please ask them. You have to unmute yourself, or you can type it into the chat if you're shy and you'd like us to read it for you. Questions, comments, thoughts? Okay, well, we've been talking for about an hour. We've covered quite a lot of material. Thank you, Alice Jo, for saying congratulations on your success. I think everybody shares that sort of that, you know, every single hospital and every community and every WIC office, and WIC, I see the state WIC director is on here as well. All of you have worked so hard on this, that all the thank yous and congratulations are shared between all groups. And Laurie says, bravo for the great work. We need to stick together and support each other, as we know. So thanks, guys. If anybody is on this call, I see many familiar names. If anyone's on the call and you haven't been part of the initiative and you want to receive our information, do type your email address into the chat. And we're taking a week off of webinars, but we'll be back in force with our summer series. We usually leave you all alone in the summer, but since we're all sort of stuck in place, then I think we thought, well, we'll give you something to watch every week. So we're going to come back with a load more exciting new webinars in the next few weeks. Thank you. Oh, well, thanks for Jean for thanking the team for all your help. And thank you, Jeanette, who was doing this in Navajo land before we began even in Mississippi. Thank you from Navajo Nation. Thank you, Jeanette, for your comments too. Okay, guys. Before we hang up, I just do want to say a couple. I don't know if we have a chance to go back to the slide about the next round of webinars, but we actually need your contributions. The next round of webinars is going to be CHAMPS and Mississippi and the whole program moving on. Okay, so it's like COVID-19. So it is sponsored by our funders who've asked us to do work on COVID. So they are going to be COVID response webinars, but we want to do sort of COVID and beyond type stuff. So if anybody out there, we're looking for material for the maternal experiences webinar on the 24th of June. So those of you especially that work with community or have access to patients who might like to speak up or anything, we're looking for some narratives, some ladies or moms or families to tell their stories about their experience of childbirth and postnatal or even prenatal, it doesn't matter really. Just the stories to do with giving birth during the time of COVID. We'd like to capture some of that. And so many of you work in the community that you may have access to people. And then the 1st of July, we really want to collect lots of short little things like, I don't know, those of you who were on our webinar a couple of weeks ago, one of the peer counsellors was saying how they play the drums during their online webinars to get everyone's attention. That's a cute little moment that we would like to share. Some places have done, you know, adapted their programs to be online, come out with new guidelines, come out with new practices, sort of creative ways to handle all these situations. The baby cafes have gone online, etc. We want to do a sort of rapid fire succession of little stories. So please, we need you guys to send us your information, be it from the hospital or the community, on anything, and we will follow up and tape a little interview or use a picture or something to illustrate your great work. So please, please, please send us your contributions if you've done anything creative, which I'm sure you've all had to do during this time. And thanks to the accolades that are appearing in the chat. Okay, I won't keep you on beyond the hour. Thank you very much. Thank you very much to my whole team, especially well, to everybody on my team, but those of us who've been in this from the beginning, Laurie and Kim and myself were there right from 2014. And then we've had Becky and Paige, Aisha and Maytal all working hard on this. And of course, all our associates in the field, Tawanda, and you know, one should never name anyone because one will forget to name people. Kathy Carruthers in Mississippi, many, many, many people. So thank you all very much for all the work that you've done, and to all our collaborators as well. Okay, we will talk to you in 2 weeks. Thanks for your time. Okay, bye-bye.